We're going over Huntington disease today. Huntington disease is a triplet repeat disorder involving a CAG repeat that's cytosine, adenine, and guanine, and the Huntington gene located in chromosome 4p16.3. Huntington disease is associated with autosomal dominant disorder, but not always, but genetic testing will indicate disease. Nearly all cases with repeats of CAG greater than 40 have the disease. Persons with 26 to 40 repeats sometimes are associated with the disease, while less than 25 nearly never have the disease. The disease itself presents as chronic progressive chorea. Chorea is the ceaseless occurrence of rapid, jerky, dyskinetic, involuntary movements. Movements are not repetitive or arithmetic, but appear to flow from one muscle to another. Huntington's disease is a progressive degenerative disorder affecting both men and women, most prominently associated with dance-like cortical movements. Early signs are individuals experience personality changes or cognitive difficulties. Later, the conditions progress to dementia, chorea, and difficulty with speech. As an example would be a 36-year-old man with a history of fidgeting for several years now has confusion and difficulty with calculations but intact short-term memory. Has more recently developed jerky movements affecting his entire body. Now having difficulty with balance and has brisk reflexes. The distal hand movements and long history of fidgeting are typical for Huntington's disease. The long, slow onset is also typical. Delirium and medication for illicit drug effects should be ruled out. Laboratory testing should be aimed at differential diagnosis such as anti-nuclear antibody, electrolytes, glucose level, creatinine level, rapid plasma renin, thyroid-stimulating hormone level, HIV antibody, and vitamin B12 levels. Imaging such as MRI scans should also be done, along with lumbar puncture, which may be considered. But genetic testing is the best diagnostic for Huntington's disease. Huntington's disease is manifested by motor, cognitive, and behavioral problems. You'll see in a patient with Huntington's disease chorea, aggression, depression, and dementia. In chorea, the characteristic lesion is of the basal ganglia. Chorea means dancing, therefore the movements are seemingly similar. Expressed by sudden, jerky, purposeless movements, Huntington's disease is caused by neuronal death via NMDR binding and glutamate toxicity. Atrophy of striatal nuclei, which are the main inhibitors of movements, can be seen on imaging. The caudate loses acetylcholine and GABA. GABA is the main inhibitor of the basal ganglia. Huntington's disease. Progression arises. Problems with coordination, dexterity, and balance can occur. Ultimately, swallowing and choking can occur. Slowing of saccades. Saccades are smooth, slow, and fast movements of the eye, are also an early sign, as well as an increased reflexes with disinhibition of primitive reflexes may be seen. Problems with executive function are relatively frequent, and patients can develop a subcortical dementia. Behavioral disinhibition, depression, and anxiety are often seen. Balance between different types of signs and symptoms are unique from patient to patient. Huntington disease in children roughly account for 5% of all patients. It is more severe and can be of the Westphal variant. The Westphal variant, which looks more like Parkinsonianism with bradykinesia and rigidity. Dystonia, myoclonus, and seizures can occur. Dystonia is sustained muscle contractions causing twisting and repetitive movements or abnormal postures. Myoclonus is a shock-like contraction of a muscle or a group of muscles, and seizures are defined as a sudden attack or recurrence of a disease. A single episode of epilepsy, often named by the type it represents. Currently, there are no drugs that appear to affect the course of Huntington's disease. The motor and psychoactive symptoms are usually treated asymptomatically. Therefore, to treat chorea, you should treat with drugs interfering with dopaminergic function. High-potency neuroleptics such as haloperidol are typically used. Sides include risk of tardive dyskinesia. Tardive dyskinesia is a neurologic disorder caused by the long-term and/or high-dose use of dopamine antagonists, usually antipsychoactives, and among those, especially the typical antipsychotics. It is an impairment of voluntary movement that continues or appears even after the drugs are no longer taken. Tetrabenzene is approved for the treatment of chorea and Huntington's disease and has been shown to demonstrate functional improvement. As Huntington's disease progresses, bradykinesia is a problem and is exacerbated by new neuroleptics. It is uncommon for these agents to be discontinued as the disease progresses. It is uncommon. Depression is very common, as is irritability and anxiety, and usually treated with selective serotonin reuptake inhibitors. Swallowing and aspiration problems become apparent late in the course of discussion of percutaneous endoscopic gastrostomy. Tube is advised, especially early in the course of the disease, to prevent adequate nutrition and decrease aspiration. Genetic to provide adequate nutrition and decrease aspiration. Genetic counseling on the patient's relative is extremely important. Paternal inheritance from the father is more strongly associated with earlier onset and anticipation at worst for the disease. Fall and injury prevention strategies should be discussed. Medications are rarely a complete treatment for Huntington's disease. Now we'll have 3 questions, and from what I've read, you should be able to answer. And mind you that the videos will get better when I have more time, and we can have a discussion down on the forums below if there's anything I haven't written or if anyone needs help out there. First question: a 30-year-old man is shown to have coriform movements. Remember, coriform is dance-like. Which test would best diagnose Huntington's disease? An MRI scan, a rectal biopsy, positron emission tomography scanning, or genetic testing? Alright, that's good. I like that. Genetic testing it is. Alright, second, which drug medication is the best to treat prior questions? Patients disabling chorea. So, would it be carbidopa, levodopa 3 times a day? Would it be haloperidol, 1 milligram 1 to 3 times a day? Or would it be deep brain stimulation of the subthalamus, or fluoxetine 10 milligrams daily? Alright, that was a tough one, but you got it. And you look like you're already ready for the boards. It was definitely haloperidol, 1 milligram 1 to 3 times per day. Now, the last question is: a 10-year-old boy has coriform movements and also seizure activity, and rigidity of the muscles. Which of the following brain structures would most likely be involved? So we got a 10-year-old boy, he has coriform movements and also seizure activities and rigidity of the muscles. Which brain structures would most likely be involved? Would it be the cerebral cortex, the cerebellum, the thalamus, or the nios striatum, with atrophy of the head of the caudate nucleus and putamen? Alright, so that one's pretty tough, you guys. That was pretty tough, but you guys did well. It was the neostriatum with atrophy of the head of the caudate nucleus and putamen. Alright, the videos will be better and better. Until next time, take care. Adios, amigos.